neglected tropical diseases affect the bottom 1.5 billion people in the world, people living on less than $1.25 a day. Over 500 million of these are children. These are the voiceless communities, communities living in very rural parts of the world with no access to clean water, sanitation, electricity. Bihar is one of the poorest places on earth. Here, 18 million children strive to go to school every day. Every single one of them threatened by neglected tropical diseases. And half of the children in Bihar already are infected with intestinal worms, making students too sick and tired to attend school. These parasites literally suck the blood out of people.
मैं तो ऐसा लगती थी जैसे मैं अब जी ही नहीं सकती, एकदम बहुत सी तकलीफें, पेट में दर्द गए से.
Yet treatment is simple and inexpensive. One pill once a year can protect a child for only 50 cents.
Deworming is by far one of the most cost-effective interventions to improve the access to education, health and nutritional status of poor children.
But reaching every child is a daunting task. So the government and local partners in India needed to find an innovative solution. Deworm the World worked to actually provide technical assistance to the government of Bihar, working with the Ministry of Education and the Ministry of Health to provide school-based deworming programs. We cannot afford to start brand new programs for the treatment of these diseases. So what we do is we leverage off existing structures. And one of the best ways of doing this is through school-based infrastructures.
In a country like India and most developing countries, there is maybe 4 or 5 teachers for every healthcare worker. So when you combine their capacities, then you have a model which has a multiplier effect.
Deworm the World used community outreach as an effective grassroots campaign.
For instance, we used concepts like school theatre, street theatre, Prabhat fairies, which are morning processions of children shouting slogans about deworming, and similar activities to sensitize the school children, their teachers and the communities around them. Children are a great influencing factor on their parents. So by talking to children and getting them to take ownership and pride in the program, it was a very effective way to pass on their message to their parents and communities.
And in only 3 months, one of the largest mass drug administrations in the world was completed in Bihar. 17 million school children were dewormed, including Jyoti.
खाना खाकर सोते समय रात में खाना था, तो जब क्लास आने की अथी हुई, सुबह उठी तो एकदम पूरी अच्छी सी लगी, फुर्तीली सी.
With the recently concluded deworming campaign, Jyoti got her medicine and the awareness, and she's healthy and happy. In this program, we targeted 21 million school-age children, covering over 70,000 schools, and we trained over 160,000 teachers and healthcare workers. So to be able to work on this problem and to show a model which can be replicated and rapidly is a very proud accomplishment.
And this type of co-investment model is pretty much the model that's going to be applied throughout the world, especially in these scarce economic times. 50 cents, that's all it takes. 50 cents per person per year. Just 50 cents that allows children to go to school and together build communities that will make them more sustainable and prosperous in the world.